My name is Chrystal Lau. I was born and raised here in Little Rock, Arkansas. For college, I moved out to California where I spent 4 years at Stanford, and then I worked for a year in San Francisco before moving back for medical school. For med school, I went to University of Arkansas for medical sciences, which is where I met my husband, Brad Stone, who's an anesthesiologist. We both stayed on at UAMS for our residency training. I completed a 5-year otolaryngology head and neck surgical residency. And then during our almost last year of residency, we had our daughter Stella, who's just a little over 1.5 years old, and she's our whole world and our pride and joy. Midway through college, I participated in the summer research program that was focused on children's health and nutrition in underserved communities. I spent a lot of time with patients in clinic and in the community, and it was through that program that I really realized that I wanted to become a doctor and to be able to help people in a very tangible way. I think one of the most rewarding parts of my job is that I get to see patients of all ages. So, in a single clinic, I can see a 1-month-old baby who's having feeding difficulties, parents and their medical providers wondering if they have a lip or tongue tie. And then, right after that, I might see a patient well into their 80s or 90s and talk to them about their hearing or their swallowing issues. And I just find that super rewarding to be able to meet with, such a diverse group of patients and be able to help them with any of their ear, nose, and throat needs. So in the clinic, we do a lot of, kind of small procedures and things like that for our patients. I see a lot of patients who come with hearing issues, and so we're lucky to have a very robust audiology department that we work closely with. So we're able to diagnose hearing loss, get patients fitted with hearing aids if that's something they're interested in or something that's indicated. I see a lot of patients for voice and swallowing problems and sinus problems. One of the other services that I offer is seeing patients with lumps or bumps, whether that is something that they're concerned about or something they're embarrassed about. And so sometimes that entails excising these lesions. We're able to remove these lesions in our treatment room downstairs. Other times I do what's called fine needle aspiration, or FNA. It's basically a form of biopsy where we take tiny needles to sample cells of concerning lesions. So this could be a thyroid nodule, a parotid mass, or a lymph node that's been growing or shows concerning features on imaging. I grew up in Little Rock, and thankfully, all my immediate family is here, and my husband's parents are here, and so we knew that we wanted to stay in Little Rock. AOC, or Arkansas Otolaryngology, has always had a really great reputation in Central Arkansas, and I knew that I would be joining a great group of other physicians that I could collaborate with and really see the rest of my career with. So I see patients at several locations to try to make it as convenient as possible for our patients. I'm currently seeing patients at our Canis location, University office, the doctor's building, North Little Rock, and Heber Springs.